It's the first clinical trial of its kind in Southern California and one of only 3 in the world. Neurosurgeons call it suicide gene therapy for hard-to-treat brain tumors. Here to explain how it works and why it's important is Dr. Clark Chen, Vice Chair of Neurosurgery, UC San Diego Health System. Dr. Chen, welcome.
Well, thank you for having me here.
Now, the suicide gene therapy, as it's called, precisely delivers treatment to certain types of brain tumors while leaving surrounding brain tissue intact, I understand.
That's correct.
What type of brain cancer does it target?
The therapy is really designed to target a particular form of cancer called glioblastoma. This is a form of cancer that is the most frequent occurrence of brain tumors and is one of the most devastating of cancers. The average survival for a patient who's been diagnosed with this disease is about 14 months. And in fact, for instance, Senator Kennedy had expired about a year after he was diagnosed with this particular tumor.
And tell us, going back to Senator Ted Kennedy, he was one very public example. What sort of symptoms does somebody who have this, what does the patient experience?
In the case of Senator Kennedy, he suffered a seizure, and that eventually led to the diagnosis of the cancer. The presentation of this tumor could be very subtle. I've had patients who have came to me because they felt that they were not able to express themselves as well as before, and it turns out there's a tumor in the area that controls their speech. There are also patients who present with dramatic presentations like seizures and even coma.
Why are these particular types of brain tumors, or brain tumors in general, so difficult to treat?
One of the major challenges in treating brain cancers is that there's something called the blood-brain barrier. This is a natural mechanism that you and I have evolved to protect our brain from harmful chemicals. The problem is, if you have a brain cancer, your chemotherapy is also prevented from going into the brain by this barrier. And so we were trying to bypass that barrier by directly injecting the therapy into the tumor.
And we actually have some video of that, of you doing this procedure on a patient. So let's take a look at that video. And while we're looking at it, walk us through what happens here. What's happening? You're under an MRI, correct?
That's right. And so what you're seeing here is we're visualizing in real time where the catheter that's going to deliver the virus is relative to the neural structures. See, to a neurosurgeon, this is extraordinary. To be able to see the catheter in its real location as we're advancing it to the tumor.
So you were putting that catheter into the tumor, and then you were injecting what?
We were then injecting the gene therapy. This gene therapy is in the form of a virus that encodes a particular enzyme. This enzyme converts a completely benign antifungal drug into a chemotherapy. So what happens is the virus is engineered only to replicate and grow in the tumor. As the tumor gets infected, they make this enzyme, and they actually locally convert the antifungal therapy into chemotherapy, so the chemotherapy is only in the spot of the tumor.
Right, and how is that? So, and it causes the cells to self-destruct.
That's right.
Correct? Okay.
That's right.
How is this different from standard chemotherapy?
The standard chemotherapy, you take a medicine either by IV injection into the veins or by the mouth, and the chemotherapy reaches virtually every single cell in your body. In contrast, the direct injection of this gene therapy into the tumor creates only chemotherapy in the tumor. And so what that means is any of the side effects of the chemotherapy on non-tumor cells is minimized.
Are there side effects to the gene therapy treatment?
So far, we haven't observed any side effects. Potentially there may be, and we are carefully following our patients for any potential side effects.
How many people in the clinical trial right now, and so far what has the outcome been?
We've treated a total of 12 patients at UCSD, and the results are very promising. That said, I have to caution that this is a phase 1 clinical trial, meaning that we're looking at the safety of this approach rather than the actual efficacy. That said, our patients are doing quite well.
Could this procedure, if the next phase progresses and everything moves as planned, could it be used to treat other types of cancer?
Absolutely, absolutely. It could be modified to treat just about any form of cancer that could be imaged on the MRI.
Is the trial still going on, and can people participate?
Absolutely. The trial is still ongoing, and I would actually put a shout out there for patients who have suffered recurrence of this tumor. At that point, there's really no standard of care, and it's important to participate in these trials so that we could advance their therapies.
All right, Dr. Clark Chen with UCSD Moore's Cancer Center, thank you so much.
Well, thank you for having me.